Omar, welcome to PharmaComms TV. Can you introduce yourself and give us a little bit of background into your field of interest?
My name is Omar Sabri. I'm a trauma and orthopaedic consultant working in the NHS St George's Hospital and University. I've been a consultant now for about 8 years. I also have an interest in medical education and training. And on the back of that, I joined forces with a company called Fundamental VR, who would do a lot of virtual reality simulation for training. My interest was always obviously surgical training, so I've helped them develop some simulations, and we're hoping to take things further in the future.
How can VR and simulation improve training for medical students and clinicians?
Medical students invest more money now into their training compared to previous, and they come into this new era on a background of very high technological abilities. We can't continue feeding them information using the old-fashioned methods. So having something like VR that is introduced to medical students opens their eyes to the possibility of where the future could be. When it comes to surgical training, which is my specialty, there's two elements to it. One is being able to identify and rehearse steps of a procedure. And the second one is being able to learn an apprenticeship, which is something you only get by actually teaching muscle memory to your hands. So being able to identify steps is where virtual reality is very important, because you can have, but that virtual reality side of things you can just learn from an app on a mobile phone or from watching a video. So you can practice the steps of a procedure or rehearse the steps of a procedure that way. Introducing haptics into the equation gives you the ability to start learning muscle memory into your hands. So we then introduced that to young surgical trainees coming through. With the evolution of platforms, of VR platforms, we then started introducing assessment tools, which will make us eventually head towards the competency-based training that we were after for a long time. Going forward, in terms of senior consultants, there's now the very valuable issue of revalidation. How can you prove that a consultant is fit to practice over and over and over again as technology goes forward? You have to have a tool that allows revalidation, and again, virtual reality is very valuable as a platform for that.
The NHS's patient safety strategy, how does VR and simulation fit into that?
So patient safety is obviously a big issue in the NHS, and it's been highlighted over and over again. In Lord Darcy's report many years ago, he has been quoted as saying, no patient should have somebody operating on them for the first time. It should all be rehearsed on a simulator. Now, where are the simulators that give us the ability to rehearse procedures? There are standard methods of simulating procedure. For example, the use of salt bones, the use of cadaveric training, that are available, but there are problems with them. The main issue is reproducibility. So how many attempts are you going to have on a saw bone? How many attempts are you going to have a cadaver? And there are cost implications associated with that. So from a safety perspective, to get the surgeon to the operating room as safe as possible, everybody knows there is a learning curve. Where virtual reality fits is to shorten the learning curve. So that by the time the surgeon gets to the operating room, there are things that he will only pick up and learn in an operating room, but at least you've taken out 3 or 4 steps along the learning curve before he's there. So therefore, his safety profile will be better, quicker.
What are the economic benefits of having virtual reality training over traditional methods?
So with traditional training methods, there are elements that are relatively cheap that you can use on numerous occasions to try and get your trainee up to the level that you want, namely saw bones, using educational videos and standard traditional educational content from a book. So that's fine. If you take it a step further to surgical training, they need the muscle memory, they need the hands-on experience. Now, for a long time, the only way of getting that was through cadaveric courses. Now, cadavers are very expensive, and if you've used a cadaver, you only have one go at it. And then, for example, if you're doing a hip replacement on a cadaver, you can only do it once. So normally, if we're running a course with, let's say, 10 trainees, you need 5 cadavers so they can all have one go. And that's it. And also, at the end of that course, what assessments have they had? The only assessment is very visual and it's very subjective. So if you now bring virtual reality into the equation, it gives you a platform whereby the training method can be reproduced over and over and over again, infinite number of rehearsal attempts, and the assessment tools, such as the dashboard that's been created by Fundamental Surgery with its own score, can give you a progression of how that individual is doing until they reach a competency milestone, after which they get accredited. So yes, it may be initially an initial investment to get the virtual reality platform in place, but over time it'll prove its value 100 times over because it's there. You can use it an infinite number of times. It's not like a cadaver where you've got one go at it and then it's ruined. So the economic argument is really non-existent.
Where do you see future investment being made for virtual reality within the healthcare environment?
So things are moving in multiple directions really. So along the VR platform, more procedures are being added all the time, which lends itself to an expansion in all fields of surgery and medicine. So that's one area. The platform, because it's so versatile, is also going global because it's not restricted to a particular set of hardware. So the company that I partner with, Fundamental Surgery, they've had a company from Korea log onto the website, download the software, put some hardware together and use it over there with full support from the UK. So on the back of that, its potential is to keep growing and growing. Other future developments, there's now a trend in surgery going towards robotic assisted or robotic performed surgery. Now, what people don't realize is it's great, but also that has a new learning curve, and that's a learning curve for experts. So experts have to learn to use this new technology. And what robotic surgery does is it gives you precision, it gives you better performance, but it adds about an extra 10 or 20 steps into the procedure. So you have to learn those steps and you have to rehearse them. And again, talking about the conventional methods of training, if you were to practice a robotic surgery on a cadaver, how many cadavers do you need? So therefore, VR lends itself to being an easy, available, relatively cost-effective way of delving into new technology with the correct or more accurate method of training for it.